Well, thank you. Government Affairs Committee, 2020 style. Um, Thank you for John Stenner for being here. Also for the governor for contributing. Um, Thank you to our sponsors, Black Hills Energy, FNPO, Northfield Retirement, NPPD, the West Nebraska Board of Realtors, and KNEB. To join today, and we'll let the governor's address, and we'll let John take it away from here.
Great. Well, hello, everybody. Thank you very much for the opportunity to be on with you today. I'm sorry we can't do this in person, but obviously we're all making adjustments with the pandemic here. I want to thank Senator Stinner for organizing this and also for his great work throughout the last legislative session. The legislature did just yeoman's work despite the pandemic and the very challenging conditions. And along with the leadership of Speaker Scheer, Senator Stinner, really was able to help us craft LB 1107, which was the significant property tax relief bill that we got passed, but also included the renewal of our incentive program, and then, of course, the project for UNMC. And then, of course, I just want to let everybody know that we continue to work with you there in the Panhandle with regard to the rising cases and hospitalizations you've had. I think we are seeing a little light at the end of the tunnel. It looks like it's stabilized right now, maybe starting to come down, but which is a pattern we've seen across the state for the last week or so. We still have to continue to make sure that we're taking all the steps to slow down this pandemic, that we have to be able to use the tools that we've been given, like keeping that 6 foot of distance, wearing a mask when you go to the store, staying home when you're sick, making sure that you're working from home if you can. You know, all these things will help us slow down the spread of the virus so that we can make sure we maintain our hospital capacity. And I know the folks in the Panhandle in our hospital, our doctors and nurses, they've all been very, very busy, and we appreciate all their great work. What I thought I'd do today is hit upon a couple of topics. One, just kind of recap the legislative session that we had, and then talk a little bit about the pandemic response as well. I mentioned the great work Senator Stinner and Speaker Scheer did to be able to pull together groups of senators to accomplish so much in this last legislative session. It really was remarkable the amount of work they were able to get done. I mentioned LB 1107, and I'll start off with that because that is so significant. And again, Senator Stinner had a big hand in this, where we were able to pass an additional $375 million in property tax relief. That property tax relief will come in the form of a refundable income tax credit. So it's a little different program than what we have already. We had been increasing the property tax credit relief fund. In fact, since I've become governor, we've nearly doubled that fund from about $140 million a year to $275 million a year. That's significant property tax relief right there. But now on top of that, we'll phase in another $375 million that will bring up the total to $650 million every year. And to give you an idea of how this might work, if you had a farm, say in Hamilton County, didn't have the, I got one, that one handy, where we did the calculations. Say you had a 980 acre farm, what you'd see when that $375 million is fully phased in, plus the $275 million that we have in the property tax credit relief fund, is that individual farm would see a $14,000 break on their property taxes, or about 21%. So you can see that is significant. And if you look at for homeowners, houses of 200,000, you're going to see a similar, about a 17% break on your overall property taxes. So this is significant property tax relief that we've been able to deliver. And again, I really want to congratulate the legislature for the great work in making that happen. We were also, as I mentioned, able to renew our incentive program, which is important for us to continue to be competitive with other states, to be able to attract those companies here to Nebraska. It's one of those things that is really a checkbox for any company that's looking at a state. If you don't have one of those programs, you're at a competitive disadvantage. And then the project for UNMC will allow them to be competitive for a Defense Department program to expand surge hospital capacity. And that is potentially is over $1 billion investment by the Defense Department that we'll be competing for. But I mentioned that 1107, but that's not the only thing we were able to get accomplished in this last legislative session. We were able to also pass our Veterans Tax Relief Package, which is a 50% tax credit on military retirement benefits. And while this does not put us on a level playing field with many of the states surrounding us that don't tax those benefits at all, it does allow us to be more competitive, to hold on to our veterans. We know that our veterans can have a 20-year career in the military and still have a long career in the civilian world, and they continue to contribute to our state, and we want to keep them here. And so being competitive is important with those surrounding states so we can make sure veterans stay in Nebraska and not go elsewhere. So that was a big deal for us. We were able to also pass our career scholarships program. And again, I want to thank Senator Stinner for his help on that, because that came through the appropriations bill. And that will allow the University of Nebraska, our state college system, and our community colleges to be able to offer scholarships to our young people in those high demand areas like science and technology or healthcare, so that we can provide those scholarships and those young people can get the education they need to be leaders going forward in the future. So that's a great step forward for us to be able to create that career pipeline, starting with what we did in 2015 with the Developing Youth Talent Initiative around 7th and 8th graders, continuing that on through the high school years through our career programs in the high schools. And I know Scottsbluff has got a great one of those career academies that is really helping young people see what all the sorts of career opportunities are there. I know they're also working on our registered apprenticeship programs with companies in the Panhandle like Alec Industries. So that's, and 21st Century to be able to do that. So that's a great step in high school. And this is the one that really kind of follows up on what we're doing with registered apprenticeship programs, and then getting that secondary education, whether it's a 2-year or 4-year degree program. So that's a great step forward there as well. In addition to that, we were able to pass the most significant pro-life bill we've passed in a decade. We passed flood relief, allow us, for example, to buy more personal protective equipment. That was the flood relief to help us recover from the flood. We also passed pandemic relief to help us buy more personal protective equipment. And then, of course, the canal relief for the Fort Laramie Canal, to be able to do the tunnel repairs there to restore that water flow to 50,000 acres for our producers in the Panhandle again. So those were all important pieces of legislation that got passed in this legislative session. So you can see, despite the challenges the legislature faced by having their short session interrupted and becoming one of the longest in memory, picking it back up again in July and finishing in August, they were able to come together and really accomplish so much for the people of Nebraska. So really a great job, Senator Stinner and the entire legislature, to be able to get all that done. Really, really great work. Now, when it comes to the pandemic, obviously here in Nebraska, I mentioned the rising cases in the Panhandle. We've seen that all across the state. And frankly, that's a phenomenon that is true across the upper Midwest. If you look at other states, they're seeing similar rises. And in fact, now we're seeing it in other parts of the country as well. As we have appeared to hear at least a plateau for now, and maybe starting to come back down a little bit. Other states are seeing surges as well. So we've got to continue to stay focused on slowing the spread of that virus with all the steps we have taken place. And just a reminder, what we've done is we put together a 6-part plan for how to address the pandemic. The first part of the plan starts with testing. And we have seen a big increase in testing here in the state of Nebraska, not only through venues such as Test Nebraska, but other venues as well that are set up to especially doing the antigen testing, that rapid test testing. We've hit days here in the state where we've tested almost 22,000 people in a given day. So that is great for us to be able to make sure that we're getting to people so that we know who's testing positive, especially asymptomatic people. And here's where, again, if you're one of those older folks who has an underlying healthcare condition, please take care. And if you start having those symptoms, get to your doctor right away, because we've got new treatments like the monoclonal antibody treatment that can help reduce hospitalizations and really help you recover much more quickly. So again, we've got better treatments. If we can find out who's testing positive, or if you're starting to feel ill, get to your doctor right away. That testing is important because the next step to follow on that is the contact tracing. So what we do then is call those folks to make sure that, hey, you've tested positive, you need to isolate. Who else did you contact, to make sure that we're then following up with those folks to get them to quarantine so they're not potentially infecting other people as well. You may have read that I had an exposure a few weeks ago, and so I quarantined for 14 days to make sure that my wife and I weren't spreading that to other people in the community. And that's what we need everybody to be able to do. The primary line of defense on that contact tracing is our local public health department. However, we at the state have trained up over 1,000 people to assist those folks. We're ramping up even more as we speak to be able to provide more contact tracing. all of our public health departments, except Lincoln Lancaster, are leveraging the state resources to be able to supplement their own local resources to be able to do that contact tracing. And so that testing and contact tracing, that's the blocking and tackling of how you manage a pandemic. And we have provided the resources there to be able to do it. And of course, again, I forgot to mention, but Test Nebraska is always a great place to be able to get tested, testnebraska.com. And we're always looking to be able to increase the number of providers, the number of tests available out there to be able to do it. The third part of our plan has to do with what I mentioned earlier with the pandemic relief. The legislature passed helped us buy personal protective equipment. And using the CARES Act money, we've done that as well. In fact, we've distributed $38 million of personal protective equipment through our local public health directors to our hospitals, our long-term care facilities, dentist's office, public health departments directly. So all these folks are getting that PPE to be able to help protect themselves. We have at least 3 months in every category. And the one category we were a little bit behind on because the entire nation was N95 masks. We're using the KN95 mask that had the emergency use authorization. But because of a contract that we have with Honeywell, we're able to ramp up those supplies of N95 masks and get those out to our healthcare workers. So we have lots of supplies of PPE on hand to be able to handle that. Our fourth step was our Nebraska accommodation project, which basically allows people the opportunity to go quarantine in a hotel if they don't feel they can do that at home. If they're worried about either bringing the virus from home into the workplace or vice versa, we have that program available. And that's been open to teachers, food processors, the general public. And that program is still out there for people to be able to use. Our fifth leg of our plan involved our special plans that we have for vulnerable populations, whether it's the plans we put in place for our long-term care facilities, for our food processors, our prison population, and so forth. We have plans put in place to make special accommodations for people who are more at risk because, say, of congregate living or congregate workspaces, so that we work with those folks to be able to take extra special precautions to slow the spread there. And while certainly, for example, our long-term care facilities are where we have a lot of our vulnerable people, and we have been impacted there with a number of tragic deaths, we have been able, because of the great work we have done in preparation for this, through things like our cooperation with the University of Nebraska Medical Center and their ICAP program, which is their Infection Control Assessment and Promotion program, we've been able to train long-term care facilities on how to protect themselves against the spread of infection, and relatively speaking, keep it lower here than in other states that didn't have that opportunity, like New Jersey, where they've had over 6,600 people die in their long-term care facilities. So again, we have been working at, we continue to work on that. And that's why you'll find that many of your long-term care facilities, for example, are not able to take visitors because we're trying to make sure that we don't have that spread within inside the facilities. We do want to allow those visitors because we know it's important for the mental health of the residents. We also have to balance that off against trying to slow the spread in those facilities so those residents don't contract. And then finally, we manage it through our directed health managers. That's our kind of our sixth pillar of our overall sixth plan. We're currently in the orange phase right now that I published of a program I published a couple of weeks ago. All of our capacity or all of our things we do here are around making sure we maintain the capacity in our hospital system. Currently, we have 32% of our hospital beds available, 27% of our ICU beds available, and 68% of our ventilators available. And so we want to continue to make sure that we keep that capacity. And we are right now sitting at 896 hospitalizations as of yesterday. And that is down from what we saw about 7 days ago. So we are seeing that the number of hospitalizations have plateaued and even started coming down a little bit here in the Panhandle as well as statewide. We want to continue that momentum by practicing all the good things we know how to do. But what I did tie those hospitalizations to is when we have 25% of our hospital capacity, our 14-day rolling hospital capacity, gets above that 25% or more, we'll go into our red phase, which will then mean that we'll go into a 10-person rule on indoor gatherings, 25-person rule on outdoor gatherings. Bars will only be able to do takeout, delivery, or drive-through. Restaurants will have limited hours. Those are just some of the restrictions we'll have in place to be able to take further steps to slow the spread of the virus. Again, we can avoid that if we can all take the steps to slow the spread of the virus now and keep those hospitalizations down. But if we see our hospitalizations start to rise again, we could go into that red phase. Also, as part of the overall response from the federal government, we've seen that they've provided over $10 billion in federal aid to us. I want to kind compliment all of our community banks because they've done a great job in working with our businesses and other organizations in getting that money out through the Paycheck Protection Program. That's been over $3.4 billion of that $10 billion. In fact, over 40,000 organizations in Nebraska have taken advantage of that program. That's in large part to the great efforts of our bankers who stayed up late, got up early, accessed the SBA website to be able to get access to that. It has been tremendous. We also, the state received over $1 billion directly, and we have put that out through different programs like our business stabilization programs, $415 million that went out to businesses, primarily small businesses, but $110 million of that went to livestock producers. We did $96 million to our nonprofits here in the state to help stabilize them, $40 million to our hospitals to help them staff up and be able to accommodate the additional people coming into the hospital system, $255 million to either state or local government, about $276 million going to our unemployment insurance trust fund that took in 4 years worth of claims in 4 months. So all these things have been able to help us stabilize the things here in Nebraska with regard to this relief and have been greatly appreciated. We really appreciate the work of the federal government and will continue to manage this going forward. Then just finally, as we look into next year, we will be continuing to manage the pandemic. We do see that the vaccines are coming this month, or actually coming this month in December. We expect that we could see shipments of the Pfizer vaccine as early as the week of December 11th, maybe Tuesday the 15th. We might start receiving those, depending on what the FDA does with regard to their emergency use authorization. Pfizer has submitted their data. The FDA is reviewing it right now. We'll have a meeting on December 10th. That's why that week of the 14th, we could be seeing those shipments. The initial shipments will go to hospitals. This is the super cold shipped vaccine, so it really needs additional, those super cold freezers to be able to keep and store it. And healthcare workers were our priority list to begin with anyway, so it's going to work out for us to be able to get those to our healthcare workers and start with them. And then also we'll start seeing Moderna, hopefully toward the end of the month as well. They have submitted their information to the FDA. The FDA will review that maybe on the 17th of December, and we could maybe the week of the 21st or 22nd December may start seeing those Moderna vaccines coming to the state as well. And so we've got a plan that prioritizes healthcare workers, long-term care workers, people who are in our long-term care facilities as residents, as vulnerable folks who are dealing directly with COVID positive patients like our EMS and so forth will also be highly prioritized. So those are the first folks that will be starting to get it. We will get it on a per capita population ratio based on people who are 18 or older, since these vaccines are not been going to children at this point. And we expect to be able to get those shipments not only in December, but also in January, February, and so forth. We've been told that the general population would expect to get this probably in April. So again, you can see that we're going to continue to be managing this, continuing to, wearing that mask when you go to the store, keeping that 6 foot of distance, washing your hands often. We're going to be doing that for the next several months. And that'll all be part of it. And then finally, as we look forward to the next legislative session, we will have a budget to pass. Because of the balance we've struck here in Nebraska, Nebraska so far has been pretty well off with regard to things like having the lowest unemployment rate in the country. Our revenues have been coming in above forecast. That will allow us to make decisions here in the state that other states who have to cut their budget they have tougher decisions to make. We're not going to have the ability to spend at will, but we aren't going to have to maybe make some of the tough decisions that other states are. And so we'll have to put together a budget that's prudent, that continues to manage our spending wisely, be able to provide any additional relief that we're going to need. And of course, continue to look for things on how we can provide additional tax relief, what additional priorities we can put in place to be able to grow our state, continue to support all the things we're doing to be able to make sure that we continue to attract those jobs that will keep our kids and grandkids here. So that's a lot all at once. Bill told me I could talk as long as I wanted, so you can blame him that I went on too long. But again, we've got a lot going on here at the state. I really appreciate everybody for all their efforts to help us slow the spread of the virus, especially our healthcare workers in accommodating the folks who are coming into the hospital system. And again, I want to thank Senator Stinner for all his great work in organizing this, as well as for his great work in the legislature. And with that, I will entertain any questions you have, and otherwise, I hope everybody has a great holiday season when it comes up here at the end of the month.
Well, this is Terry, and since we had the governor recorded, I don't know that we're going to be able to ask him any questions. So if you have any questions, I guess we could put them out there, and Karen can maybe field them back and forth with the governor. Otherwise, I think I'll turn it over now to Senator Stinner.
Thank you very much. Thank you, Chamber, for sponsoring this. This is always kind of a highlight. It's as I asked Karen if there were any eggs and bacon being delivered to the house just for breakfast, but she said no. So thank you, Chamber. Thank you, Governor, for those remarks. That was pretty comprehensive. He actually covered a heck of a lot of what I was going to talk about. I still will try to bounce through some of those points to reinforce and maybe add some color to it. I see Kim Engels here. Kim, I'm glad that you're still upright. Great job that you're doing with Panhandle Health. This is a crisis that needs to be managed. Obviously, from the governor's remarks, we're going to have to manage certainly through April, possibly May. So, you know, follow the CDC guidelines and please stay safe. As the governor mentioned, just to kind of a look back, we had 43 days of what I would call kind of a normal session. And his budget recommendations, as he indicated, had the H3 piece 2 initiative to his budget recommendations. He also asked for $55 million of additional flood money to cover the FEMA costs, or the shortfall of what the state has to come up with in terms of addressing the flood and reimbursement of FEMA. A little bit over $9 million, $9.4 million actually goes out to about 5 counties that were short and had extensive damages. So the state is trying to help those counties. That was the big number in the budget. I do want to cover, you know, homestead exemption. There was another $5 or $6 million that was requested of additional homestead exemptions, which pushed the homestead exemption over 100 million. I think it's about 100 million is 101 million as reimbursements to county for homestead exemptions. If you put that together with the 650 that we're projecting for property tax relief, that's $750 million of total property tax relief. So when somebody says we're not doing anything for property tax and property tax relief, you know, have them come see me, and I'll add and subtract for them. I know that there's still some additional work that needs to be done, and we will do that, but I'll try to explain in detail about 1107 later on. Actually, from the appropriation side, we had over $100 million of requests to appropriation. You have to remember, for 4 years, we hadn't passed anything with a fiscal note. So we were bombarded. 43 pieces of legislation came. Normally we'll have 25 to 30. So we had a heightened request in appropriation to kind of slowed us down a little bit, because you have to hear every piece of proposed legislation. In that, we tried to prioritize a few things. $10 million is actually not a general funds request, but certainly a transfer of tax receipts to workforce housing. Workforce housing was introduced by Senator Williams from Gothenburg. It was $7.4 million the first time it was passed. Yet those funds were immediately used up. $10 million now has been allocated for additional. I did make the comment that the state of Nebraska extends past North Platte, so I hope Scotts Bluff is able to participate. I threatened them as best I could, guys. But anyhow, we should get some of those workforce housing. Obviously, there's a need throughout the state, but Scotts Bluff certainly deserves to have their equitable share. Along with that, there was about $15 million of requests, scaled down requests, that we included in the recommendations to the legislature. And really what I tried to do was focus in on workforce and workforce development as an area. We had 2-3 studies by HHS that we're now trying to bring cost to parity with behavioral health and developmental disabilities. Those two areas were studied by HHS a couple years ago. We've been incrementally bringing that up to parity. So that was another piece of it, a pretty large piece of it. And then corrections obviously was another area of interest and will continue to be an area of interest. I know that there is a proposal out there to build a prison that will be discussed this session. I'm actually headed to Lincoln right after this for discussions on COVID, briefings on COVID, along with briefings on the prison. So I'll be a little bit better versed on this subject. Obviously, that's something we've been working on. Interestingly, in the governor's proposal, he also increased wages at the prison. We had a problem with hiring people. We had a problem with parity with Lancaster County Jail and Douglas County Jail. Those wages for guards were brought up to parity with that so that we can actually maybe hire a workforce. We still have 155 to 200 jobs from time to time openings in our prison system. And that leads more into overtime and obviously morale problems and the like of that. And then there is mandatory overtime within the prison system. And we're trying to get ahead of some of that. Some of that has to do with pay scale. Some of it has to do with just the workforce that's available to us. So those are areas that we're kind of working on. I really do want to thank the governor for putting the Garingford-Laramie ditch request in his proposal. It made a whole lot easier than me dragging an amendment to the budget. That helped that to go through. $3.8 million is available and will be helpful. There's possibly additional dollars that might have to be allocated. I guess I'm just kind of in a heads up mode on that. I'm not even sure if there's a final as to how to mitigate some of the problems that they have. Interestingly, there also is a proposal which I put together for a study on the entire irrigation system as it relates to Nebraska, the infrastructure part of that. I think there's dollars that we need to look at. There's studies that need to be conducted. That'll be probably a 2 to 4 year process. Engineers will have to come together and put together costs. Certainly have to have a compelling business case for the legislature to react to that. So brought the budget, everything was going well. Revenue was really doing well. We were projected to be about 270 over it. And actually my last projections were over 300 million over the certified, which would have gone into the rainy day fund, would have brought the rainy day fund up to projected amount of 731 million, really close to a full allocation for the rainy day fund, 16% full. It was sitting at about 14%. So I was feeling pretty good. 133 million we brought to the floor to address property tax. 1106 was sitting there, which was Lou Ann Linehan's proposal as to property tax relief having to do with schools directly. And I will tell you, the more I studied it, it was really kind of an incomplete legislation that we brought in. They were still running, I think they must have ran 50 or 60 different computer scenarios. Cost containment was a big problem with school districts. Superintendents were very unfavorable. So that ended up being a subject that carried over into the off season, if you will, the suspended part of that. I was involved in numerous meetings about how that was going to work or not work for schools and property tax relief. So 1107 was the outcome of actually the investigation and support or lack of support that bill actually ended up having. So March 12th, we suspended, and then we came back March 23rd, 24th, and 25th. We passed a special bill, which I carried, LB 1198, provided $86 million of COVID money at the discretion of the governor. In other words, the governor came to us with about a $55 million proposal for different areas that needed to be looked at. in anticipation of the federal government at some point passing some relief, but certainly to bridge that gap. We increased that to 86 million, giving the governor additional dollars just for contingency dollars. That was taken out of the rainy day fund. And the governor basically had the discretion of those. Obviously, COVID relief package, CARES Act, was passed. I actually followed how they were instituting some of those dollars being flowed to the various agencies and then on out into the field. Still a lot of work to be done on the COVID side of things. That has not abated whatsoever. So I'm gonna have a briefing. We're gonna take a hard look at how the dollars were spent. A separate accounting system, by the way, was set up for those dollars so that it would be more transparent. And I think I'll be able to dig into it along with my committee to see if there is areas. Now, we did allocate additional dollars, a little bit of dollars for the public health side of things toward the end of the session. So I think there was $1 million or so that were allocated out of these dollars, that the 86 million. So we suspended action, and actually the budget did come in. Obviously, we moved the filing date, which was $280 million of tax receipts, ended up being individual tax receipts moving from April into July. That was the final number. We were estimating anywhere from 250, 270, 300. We were all over the map. So we weren't real sure how many dollars were actually going to show up in July. So that was suspenseful as it relates to the budget. The other thing is what the COVID impact was. Now, we had a pretty good run rate. As I said before, we had over $300 million of excess that looked like was actually going to happen. It did not happen. COVID hit. Obviously, the state suffered in terms of tax receipts as it related to their run rate. But we ended up actually having about 17 million of excess. So that was added to the rainy day fund. As the governor indicated, the state of Nebraska did not suffer the unemployment rate that a lot of states happened. Interestingly, sales tax held up throughout this whole entire process. And that is a real stumper for me, because that's where we thought our leading indicator would indicate where the state tax receipts would be. Senator Scheer, or Speaker Scheer, wanted to reconvene in June, and I actually talked to him out of it. I said, we need to assert how much of these dollars actually came from July. We needed to assert how we actually ended up the end of the fiscal year, June 30th, what those tax receipts actually look like. And also possibly calling an emergency session of the forecasting board. All of those things he postponed till, I believe, July, and I got it written down here, July 20th is when we came back. And the forecasting board agreed to an emergency session. I was prepared to cut, as I said, we brought 133 million to the floor excess. I was prepared to cut 50 to 100 million dollars out of the budget as kind of a runway into the next biennium. The forecasting board, the receipts ended up higher than what we anticipated. IHS and Moody's are economic services that we rely on to give us indications of where tax receipts are going to be. Their initial response to the COVID crisis was a 10% decline in revenue. So when you put that onto a $5 billion budget, annual budget, that's $500 million. 500 million would have been about a $100 million cut. So that's what I was really prepared for. Obviously, that did not happen. Sales tax, as I said, remained fairly high. Individual income tax came in at 280. So the state ended up being in reasonably good revenue shape. Forecasting board ended up knocking down, I think, about 50 million instead of, the 200 that I was looking for. So as we reconvened and really started to work on property tax relief and on legislation, that really put us into a situation where we could pass a budget intact. The legislature could, as it was recommended. Hopefully no vetoes, and it ended up being no vetoes. But there also had to be some kind of an agreement on the incentive package for the state of Nebraska that was sunsetting. We would have been one of the few, if only, states in the United States not to have a major incentive package at state level. I think in the COVID situation, this would have been a terrible statement to send to our small business people and our business community in general. So that was an absolute necessity. The University of Nebraska came up with their proposal that they needed to have us contribute $300 million to a $2.5 billion potential for attracting a research and actual emergency hospital situation that dealt with bioterrorism and a whole list of other things. And the time is right for that discussion. We sit in the middle of the state. Sac Air Force Base is a big positive. This would have been 8,000 jobs, $2.5 billion project. Payback was inside of 10 years. It's the best economic package I've seen ever. I can say that in my entire career, because you could pinpoint dollars going out and dollars coming back. So that needed to get done. They needed to go to the different federal agencies with this commitment as to a private-public partnership. Along with the state, there was private dollars at $300 million, and then $1 billion requirement commitment out of the federal government, which would have put all the brick and mortar in place, and then there's obviously infrastructure around that. Excuse me. In any event, those two packages were put together by the speaker along with 1106. 1106 was failing miserably, mostly because of the restrictions that were being placed on spending at the school level. Once again, we were trying to impose restrictions on local spending, which I think relies on our local government to decide where they want to spend money and how much. Now, we do have restrictions on general fund growth. We do have different restrictions on how much cash, those types of things. So it isn't like there isn't some kind of restrictions on the local side of things. A first vote was taken, and I guess the first 3 hours were presented. Senator Linehan did not have the 33 votes that were necessary. I think she had 20. And so that called the necessity to come together with a group of senators to negotiate some kind of package, because we had to get the other two passed. And without the other two, it just wasn't going to pass. So anyhow, that put 7 of us in a room for most of the session. As the governor indicated, 1107, he went through the overall merits. But I will tell you this, and I wanted to go through this just so that you're assured that what we did was really prudent, and I think prudent. First of all, since I started in the legislature, fully funded budget, we actually went from about a 4.1 average to about 2.4% average increase in spending. We're projected to be around 2.3, 2.5, somewhere in that neighborhood. That fully funds all of the agency requests. So the point is that I'm trying to make is a 3% budget really looks like, in these economic times, appropriate for advancements in spending. But anyway, obviously, we're just looking at a confined period of time. 3.5% was a number that I presented to the group of 7 as a safeguard. And what the safeguard says is we can pass budgets at 3% and fully fund all the needs of our agencies, and a 0.5% contingency, just in case you have a prison, just in case there are additional dollars that are needed for Medicaid expansion. So we put a fail-safe in there. So first of all, we're going to fund the state government. 3.5% was a number that we selected. The legislature agreed with 43 votes that was the appropriate level for spending. So we're not cutting spending. We're not interfering with. I heard schools are concerned that they're not going to get funded. Schools have always been funded, even during the times where we're cutting $1 billion. Schools actually had an increase of $60 million. So I think we've demonstrated that that's a priority. It's a priority that we'll continue to maintain. But interestingly, after that, we have laws on the books, which I ended up passing and nobody understood. But once you hit 3.5% under current law, half of the dollars that are over the 3.5% go into the rainy day fund. And I put that in there to build the rainy day fund because those are dollars that will cushion you through some kind of economic downfall. And that is in place today. The other part of that is half of those dollars above 3.5% will go for property tax relief. So what we wanted to do and what we wanted to make a statement is, first of all, we respect the fact that the state government have to fund the agencies. There's certain things we have to do, and that's 3.5%. The second thing is we want to fund property tax relief on an ongoing basis through growth. The other one is that no dollars would flow unless the rainy day fund got to $500 million. So we started out with 125 million and 125 million to go for property tax relief. And then it builds up to the governor's amount of 375. It is an income tax. You will get a receipt that says this files on your tax return, your individual tax return. It is a credit to your tax. So if you don't pay any tax, you have a loss, you still get the money. It's a refundable tax credit. So that's 1107. That's the highlights of it. There are safeguards. We're definitely committed to prioritizing the state as far as education is concerned. We're prioritizing and have to, what I call the have to side of things, Medicaid expansion and Medicaid. And then, of course, we've got a corrections situation that continues to loom. We still have an overcrowding situation that we need to address. So I think we took care of making sure that our fiscal posture was right, making sure that we're only funding this through growth. But certainly all the projections show that we can fund it within a 5-year period of time. Interestingly, after session was out, we did balance the budget, but there was a huge deficit of 845 million projected to be in the next biennium. And as I continue to try to, I guess, pacify, for lack of a good word, but continue to try to show that the state could fund certainly the state government and still survive this 845 million. Projections were still positive. We were still running positives on receipts. We still are running positives on receipts. I think November, the last I looked, was 30 million above what we had projected. That's above projections, not above certified forecast. It'll actually come out to be $80 million. So we're really rectifying that shortfall that we had projected. So what happened was we had a forecasting board. The forecasting board came in and readjusted everything. Now we're in a situation where there's a positive in the next biennium. There's a shortfall of about 170 million in the biennium we'll be working on, but it doesn't have transfers, which are automatic transfers. It doesn't have a lot of the things that we will make adjustments. So I guess I'm feeling fairly good if we stay stable. We have 2 more forecasting boards, February and April, that I have to live through. The other thing that we did get passed, which I'm very, very happy, is we passed the land bank legislation. That took me 4 years, and either I'm really stupid or something, but I stuck with it because I thought it was significant legislation for rural Nebraska. We got through, in the first 43 days, we got through the second round of that debate with 33 votes. And with the understanding that we would make some modifications. It ended up there were 29 modifications on the land bank bill. All of them I thought were fairly superficial as opposed to really curtailing the ability of the land bank to function. But now we have the land bank. I've talked to local folks. I think we're going to put something together. This is for those nuisance properties that have been abandoned, that have tax levied on them, that make them totally uneconomically viable for an individual to come in and buy them to pay the tax receipts. This is the vehicle to really kind of clean up the Mitchells and the Morrills and the Minutares and the Garings and Scotts Bluffs. And I think that is significant legislation. When I talk to most of the mayors that have been involved with the legislation, they thought it was as significant as LB 840. We'll see how it comes together. I think our land bank will be regional. That was how we proposed the legislation initially. Omaha has had the land bank over a long period of time, for about 5, 6, 7 years. Land banks have been out there for a long period of time and functioning quite well. So we'll see how we progress on that. I know that the League of Municipalities is highly involved. There's other folks that have been involved in trying to understand the impact and then trying to put together the appropriate structure for that. The governor mentioned, really covered a lot of bases over this session. Certainly the military pay, the exemption up to 50%. We're trying to be competitive. Iowa does 100% on retirement. This is a good workforce. We're still looking to enhance workforce. Certainly the H3 was a proposal I had made several years ago in education. It now has legs in the governor's budget to grow to a fairly significant amount. That's about retaining our best and brightest and still competing with other states that offer full rides. And full rides meaning not only like our Regent Scholarship does, tuition, but they cover books, they cover fees, they cover the room and board for people. So we're trying to be competitive with those states, and certainly trying to focus in on our best and brightest and our high needs. So those are some of the areas that we looked at. As far as this session is concerned, it's a coin flip. There's people that have talked to me about, let's elect the leadership and then suspend for 30 days or 60 days. The problem with that is we have to turn out a budget by a certain date. Otherwise, the governor's budget gets put in place. And our responsibility, our only true responsibility, is to pass the budget. I think we can do that. I haven't talked to the governor recently about any initiatives he would have. I know that there's the prison situation that will be debated. I will take a hard look at the COVID situation and how that's impacting our states, and what we could do relative to public health plays a huge part in the next, played a huge part, and will continue to play a huge part in the distribution of the vaccine. And certainly the medical community will as well. So what the needs are going to look like from a budgetary standpoint, I don't know. And who knows, I may not be chairman of appropriations, but I have been for 4 years. Feel comfortable with where we're at from a financial side of things. The rainy day fund now is projected to be over 600 million. So that's getting us closer. I'll continue to emphasize that. So when I leave, at least we'll have that economic shock absorber in place. We'll have funded. And the one thing I do want to say about 1107 I forgot about is it still has an accelerator clause. So we're at 375 million. The next year, as assessed valuations go up, so does the tax credit. So it's going to keep up with the assessed valuation increases. So obviously the 375 could grow substantially over a 10-year, 20-year period of time, but at least keep everybody equal. The one thing I do like about the tax credit aspect of this thing is a percentage cut, a 10% cut in property tax in Scotts Bluff equals 10%, in Omaha equals 10% in Albion. So it's across the board, as opposed to the current tax credit that's based on valuations and has some distortions in it. So I think it's a fair way of going about it. I would have liked it to be a property tax credit. as opposed to an income tax credit. I think that muddies the water in a lot of people's minds. But I think it was substantial. I think we got a lot of stuff done that I was a little concerned about. We're now talking more in terms of be civil within the legislature. So with Ernie Chambers gone, we have a shot at least having, pretty good discussions. Hopefully that covers some of the areas. I can go on for a little bit longer, but I should probably open it up for questions. I see Dennis Haddon there. He's always an inquisitive guy. Hopefully you're taking care of that hospital, Dennis.
We all have our challenges.
Yeah, yes, we do. Deb, you got a question? I can just see it.
We heard a little bit about the potential for bringing back what's referred to as the Inland Port Authority. It was a bill that was introduced, I believe, by Senator Wayne maybe 2 years ago that creates an additional way to incent potentially some warehousing, some logistic transfer from trains to trucks to that sort of thing. Have you looked at that, or do you have a feeling about
Well,
that?
I do, Deb. I do not have a feel for that legislation. I did
We'll
help.
make sure that you get some information then.
I appreciate that. And, the Heartland Expressway, I didn't see anything going on that. Did they suspend that because of flood or?
We had a bid letting. I think they let bids for that piece. It'll be from south of Alliance where the 4-lane ended onto the actual Baird turnoff. So that'll be the next piece.
Okay.
We continue to have conversations about that. And of course, with a change of directors, we don't know where we are in terms of knowledge about it or priority for it, but we will certainly make sure the governor considers that when he selects a new director.
Well, actually, part of the reason I'm going back is we got a joint session with transportation, and I'll get to meet the new head of transportation and I guess of roads, excuse me.
Yeah.
So that
Actually, it's transportation. You were correct.
It is transportation. I get that back and forth, So I'll have a chance to inquire about that, but
Super.
I appreciate all the efforts that you all have put in on the Heartland Expressway. Hopefully we'll get that done within our lifetime, right?
I do hope so. Thank you.
Senator Stem, I just wanted to thank you again for that appropriating the money for the COVID response. That's one thing we really haven't had to worry much about. We've had a lot of other things to worry about for sure, but that in addition to the CARES Act has really provided the resources we needed. Although we sometimes did not anticipate the amount of resources we needed, especially in people. When the surge came, we didn't have enough staff on and the state didn't have enough staff on. So there was a kind of a rough couple of weeks there, but we're managing it now, but we do anticipate there probably will be another spike over the holidays. It's interesting, our numbers have gone down quite a bit. Just over the last, I just figured, I think we're at a 29-day doubling rate right now for number of cases. And during that time in November, we were at a 16-day doubling time. So I've talked to the university folks to say, why do you think the numbers are going down? And they said, well, maybe folks are really taking to heart the preventive measures like wearing a mask and social distancing, or folks aren't getting tested as much, which I hope that's not the case. I hope that they're continuing to get tested. So,
are you still in need of personal protective equipment?
You know,
okay.
all of the PPE comes to the health department. We get a shipment every week, and those entities that are able to put in a request, it's healthcare, long-term care, police, schools, road departments. It's a huge list. We are not hearing from them that they're not getting what they need. So once it gets here, then we divide it up and deliver it. We've lost track of how many miles we've put on vehicles, but we are hearing from the procurement officer, Doug Carlson, that there may be a shortage of gloves in the world coming up. So that's a concern. And we have gotten some of those Honeywell N95s that the governor spoke about. It's not that everything we're getting, it's different every week. You know, it depends on where they can find it. So it's not probably the choice that most healthcare facilities would want, but it's something, and it has improved significantly from the very first few months. Some of the stuff that was coming in was almost laughable, but it has improved greatly. So.
Testing is something that I hear about, the turnaround in testing. Yeah, I was just in Florida and I did a rapid test before I came back.
Mm-hmm.
Are we in a situation where we can do rapid testing? And
yeah, so Test Nebraska we have several sites throughout the Panhandle where Test Nebraska is available, but that's probably a 2 to 3 day turnaround. And then I would say most every community there, the healthcare facility has purchased equipment. It's antigen testing, and it's very reliable if the person is symptomatic. And so most communities also have some form of rapid testing available. There are times when the supply chain for those ingredients aren't there, and so they're limited, but the testing options have improved immensely also. But boy, during a surge, nothing is enough. You know, it just takes everybody by surprise how fast that happens. And I know people couldn't get tested for a week in some cases. So.
anything else?
Senator, I know the gambling changed for casinos and there will be some property tax relief. When will we see something come to fruit for budget-wise timeline?
You know, that's a good question. I saw a fiscal note when it was first proposed, and it would be a year for anything to happen from tax receipts coming in. And then obviously there probably will be a surge in dollars that will come in over a couple of year period of time, building to about $80 million of property tax. If you saw legislation was passed, even though the referendum, I think, calls for 50% to go to property tax, the rest go to general fund, all of it was committed to property tax. That will go into the property tax relief fund, which is a direct credit to your property tax. So it takes a while for it to ramp up, but I'm going to say within a 4 to 5 year period of time, you should see about $80 million of tax relief based on what I saw in a fiscal note. And we'll try to track that, Karen, and get a better feel for it as we go. You know, we have a racetrack in Mitchell. All we got to do is get somebody that wants to put a little, you know, you only have to run them 2 days. And I've already talked to the quarter horse people in Hastings, and they're ready to go. So might be something. You know, term limits does have its privileges, you know. Anything else? 9 o'clock. I got to head to Lincoln at some point, but it's always enjoyable to see the faces. Thank you all for your support. I see a lot of people that have supported me over the 6 years that I've been there. 2 more left. We got to start thinking about somebody that wants to get into this crazy deal. it takes a heck of a commitment, and 6.5 hours down, 6.5 hours back is, it takes effort. Let's put it that way. But hopefully we'll find somebody that really wants to do the work, and I'm sure we will. So thank you. Thank you for your time.
Senator, we appreciate you being on. And for that, I'd like to thank everybody and our sponsors, First National Bank of Omaha, Black Hills Energy, Nebraska Public Power District, the Board of Realtors Residency, and thank you all for joining. Have a great day.